Well, I see a lot of, with stroke people, I see a lot of aggravation. I see blood pressure, a lot of smokers, a lot of fat people, heart problems, and I enjoy it. And it's good for me because it helps my head when I'm thinking to people about a stroke, about everything. I'm pushing my head for me when I'm helping people. 8 years ago, I had a stroke. I was fat. I was 180 pounds. I was a smoker for 30 years. I love fat food, no exercise. If I saw a person walking or running, I thought they were crazy. I worked hard, pressure, and because of that, I had the stroke.
Our big dog was Bob's best friend for the last 7 years because Bob could practice talking to him. Bob would go on walks with the dog, and he talked to Tina, and Tina wouldn't laugh at him, where people would laugh at Bob because he spoke funny or the words didn't come out correctly. But Tina never laughed. All Tina wanted to do was go for another walk or go for another run. These things are important. These are really important. Where I went for dinner last Saturday night isn't important. If I went shopping at the new Neiman Marcus that just opened, that's not important. I don't care if I ever get there. Seeing Bob healthy, seeing the way that my family has changed their eating habits, their health habits, those things are important. When Bob came home from the hospital, there were many things that he couldn't do. He couldn't read. He couldn't watch television very much because of his eyes and also because of his attention span.
I don't know what they're talking about on the TV.
That's right.
Yeah, when we started TV, and I kept asking Loretta, I don't know what they're talking about. And it's so easy to walk away and to hell with it. But you tried again and again and again, and that would Loretta would sit down with me and tell me what's going on the TV, and then I would understand it just like that.
John and I are here to tell you about stroke. It's important that you understand about stroke since 500,000 people are affected in this country each year. There are 3 million stroke survivors. It is the leading cause of adult disability, and it is the 3rd cause of death in the United States. All of you who are watching this video have been affected by stroke. You understand that it affects the whole family. Stroke can be prevented. It's very important that you understand the risk factors.
Like you, I'm one of the lucky ones. I had a stroke 3 years ago. Very disabling stroke. I couldn't speak. My whole right side was just was paralyzed, and my comprehension, my reading, my everything that you know that you get, that you take for granted is gone. I didn't take my medication, smoking, just living as if I had all the time in the world. You know, I'm 49 years old. Well, I think one or two things comes out of crisis. You can either learn and grow, or you can die. It's simple as that. What I choose to do is to live.
Your physicians asked you to look at this video because you've had a stroke warning sign, a TIA, or you've had a full-fledged complete stroke. In either case, you're living with the risk of having a stroke. But the most important message in this video is that most strokes can be prevented. You can do a lot to reduce your risk for stroke. It's important to know the stroke warning signs and the 9 things you can do to reduce your risk and possibly prevent a stroke. First, let me tell you what a stroke is not. A stroke is not from bad luck or a punishment from God or a mysterious something that happens in your body to paralyze you. A stroke is like a heart attack, a coronary, but it happens to your brain. Heart attacks happen because the blood supply to the heart muscle is reduced or blocked completely. Therefore, the heart muscle is starved for oxygen. Some strokes are caused by bleeding in the brain called a cerebral hemorrhage, but most strokes or stroke warning signs happen because the blood supply to the brain is reduced or blocked completely by a blood clot. You know what a heart attack is. A stroke is a brain attack, and the brain becomes starved for oxygen. Because your brain controls everything that goes on in your body, the effects of a stroke may happen almost anywhere in your body. But regardless of the effect, the cause is in the brain. The brain is a wonderful and complex organ, directing all of our functions. The left and right sides, the cerebral hemispheres, are where thought, memory, speech, and deliberate control of your muscles originate. The right side of your body is controlled by the left side of the brain, and your left side by the right. The middle of the brain controls your emotions and feelings and acts as a relay station to other parts of the brain for sensation and movement. The cerebellum, located to the rear of the brain, controls balance and muscle coordination so you can walk and run, work and play. The brainstem controls your life support systems, such as breathing, heartbeat, and blood pressure. It's in the cerebral hemispheres that you receive and process information from the outside world through your 5 senses: sight, hearing, touch, taste, and smell, and enable you to communicate through speech. And it's here that you direct your movements, create new ideas, make plans, and interact with others. The brain is your body's biggest consumer of oxygen and sugar, which is carried to it by the blood. Even though the brain is only 2% of the body by weight, it consumes about 20% of your oxygen supply, which it receives through an extensive and sophisticated network of cerebral blood vessels. Let's take a closer look. The 2 carotid arteries arise from the aorta just above the heart, and 2 vertebral arteries, branching from the subclavian arteries, supply blood to the brain. As you can see, these vessels branch and rebranch to form the extensive network of cerebral arteries that provide blood to the specific parts of the brain. But the brain's huge requirement for oxygen make it highly vulnerable to interruption in supply. If the oxygen supply to a part of the brain is reduced or interrupted for a short time, you may have a stroke warning sign. For example, if blood flow to the area affecting speech or thought should be reduced or temporarily interrupted, you would have difficulty thinking or speaking. If the same thing happened to the part of your brain affecting control, feeling, or sensation in your face, arm, or leg, they would feel numb or weak. If blood flow to the brain centers for vision were reduced, you would have blurred vision or might even lose your vision. And if the blood flow to the area affecting coordination were stopped or diminished, you'd become dizzy or lose your sense of balance.
The mini stroke was about a year or 2 before. The reason I knew it was a stroke, after it happened, I got up and I went to write something, and I couldn't write. And I looked at it and I said, something's wrong. And I started to write again, and I was writing scribbling, and I knew that I had had a stroke. So I called my doctor, and of course he told me to come over, and I did, and they told me I had had a stroke. But then I got over without much treatment, just rest and whatever medications they said. And it didn't knock me out. I really got over it very fast. And they knew I had diabetes, that they knew. I didn't have high blood pressure that I knew about. My pressure was a little high, but I didn't have any difficulty. I seemed very well. I went to the doctor to keep checking myself, and my pressure was pretty normal. It wasn't too bad. And the day that it happened, I was sitting in that chair again, and as I say, I got up to go. When it happened, I just got up out of this chair, flew across the room, and fell down.
When this happens, and then the blood flow resumes after an interval of a few minutes or a few hours, you will have had a stroke warning sign, or a stroke. Stroke warning signs are also called transient ischemic attacks, or TIAs, and some people call them mini-strokes. Transient meaning the symptoms pass when blood flow resumes. Ischemic meaning the brain tissue has been deprived of blood. And attack meaning you've had one or more of the symptoms, which are the warning signs for stroke. Let's review the warning signs for stroke. Sudden blurred vision or loss of vision in one or both eyes. Numbness, weakness, or paralysis in your face, arm, or leg on one or both sides of the body. Sudden difficulty speaking or mental confusion. Dizziness, loss of balance, an unexplained fall or weakness. sudden severe headache, or an unusual headache. Most often, a warning TIA happens suddenly and then goes away in 3 to 5 minutes. Other times, there is more than one symptom, which may last for a few hours. In either case, the stroke symptoms can be quite severe.
I was sitting at my desk studying about 8:30 in the morning, and all of a sudden I lost focus. I couldn't concentrate. I couldn't even see the page. And then I got dizzy and numb from head to foot. Slight headache. And I tried to get up, and I could not get up out of my chair. For some reason, I just couldn't keep my balance. I wanted to scream out and yell for somebody to help me, and I couldn't even speak. I felt real numb around my face. I tried to dial a phone, and my fingers just couldn't coordinate the dial tone. I ran to the door, and all I could get out was, "Please, somebody help me." And a neighbor heard me and came in and assisted me. Took me down to her apartment and called the paramedics. But if I had been home alone, I don't know what would have happened.
However, the most important thing to remember about any TIA is that it is a serious warning of a full-fledged stroke. Although the symptoms pass, a TIA warning should never be ignored. But what is a stroke? As we've seen, when the blockage or reduction in blood flow is short or transient, you may not have permanent damage and you will likely return to normal. But when you have a full-fledged stroke, the blood flow is stopped for an extended period of time and the affected brain cells begin to die. The longer the blood flow is interrupted, the greater the likelihood that the damage to that part of the brain will result in some temporary or permanent impairment.
Well, the first time that I thought something bad was going on was the night I had the seizure. I felt extremely tired. I had been home, and I wasn't aware that I was doing some things that wasn't normal for me.
But she had times when she couldn't remember people's names, and she would reverse them. And then she'd turn around and have all this wonderful conversation with you, and you thought she understood everything that was going on.
I think it was because my blood pressure was high, and I think it was because of cholesterol, and I think my diabetes had a lot to do with it, and the fact that I was carrying around too much weight. I was a busy person, and I did not pay attention to my body like I should have.
When I saw my mother that evening, and the condition that she looked terrible. And if someone gets sick like this, and you want to see them, expect not them to look pretty and in their Sunday clothes. And I thought, Mama, you're going to die. And I had that great fear.
My main thing in life, I guess, is to wish for people to not have to go through what I did, even though it was a short period of time. Not to put my friends and family and my co-workers that were working with me that were concerned about me, to never have to put anybody else through that type of thing. And I know that the sensible thing to do is to eat what I'm supposed to do, take my medicine like I'm supposed to, and to share with anybody that wants to ask me about it, to tell them. Because that's one of my main things in life, is try to help the other fellow.
Of course, having a stroke is justifiably the greatest fear. 12% of those who have a stroke will have another in the next year. And over 3 years, the risk of recurrent stroke increases to 25%. Over a 5-year period, 35% of all people who have had a TIA will have a stroke if they do nothing to modify their risk. That's why it's so important to modify your lifestyle. For example, 2 of the patients you met had TIAs, or transient ischemic attacks, temporary events. They got a warning. Their blood supply was interrupted, then returned to normal. But with the other patients, it was longer. The blood supply did not return to normal, and they lost their ability to speak and walk. You might say some patients had warnings and some had completed strokes. The fact is, they both had the same thing. The only difference was whether their blood flow was restored quickly or not. Reduction or blockage in the blood supply typically happens when an artery becomes blocked by a blood clot called a thrombus or an embolus. The thrombus forms in a cerebral artery where it becomes narrowed by a buildup of a fatty substance resulting in atherosclerotic plaque. Too much cholesterol in your blood is one of the factors that causes this buildup. High blood pressure and smoking also increase atherosclerotic plaque. Then what sometimes happens is that a blood clot forms in that narrow place, completely plugging the artery and stopping blood flow. This is called a thrombus, the formation of a blood clot at a narrow place in an artery in the brain. This causes a stroke. As I said earlier, when this same process happens in the coronary arteries supplying the heart muscle, it causes a heart attack. Another very common cause of stroke is embolism. This blockage is caused by a blood clot that forms in the heart or the neck arteries, then breaks loose and is carried through the bloodstream until the clot lodges in an artery in the brain, restricting or blocking the blood flow and causing the stroke. If the clot dissolves or breaks up quickly, you may just experience a warning sign, a TIA. We've learned several key points about thromboembolic stroke. Strokes happen in the brain, not where you experience the symptoms. Usually, only a part of the brain is affected. How serious the consequences of the stroke are depends on which part of the brain is affected and how great an area of the brain is affected. It's important to know the warning signs of stroke. Most often, a stroke is caused by a blood clot, either thrombus or embolus, that reduces or blocks the blood supply to a part of the brain, and that part of the brain is denied the oxygen it needs to keep doing its job. Now we'll look at the risk factors for stroke and show you the lifestyle changes you can make that will reduce your risk and increase your chances of preventing a stroke. There are programs and medications that will reduce your risk, but only you can swing the odds in your favor. Let's look at those risk factors and see what you can do.
The main cause of strokes is hypertension. And one of the reasons for that is failure to take your medication once you've discovered that you do have hypertension. That's what happened to me. I didn't take my medication. I was on the road, neglected it for about 2 months. I would suggest strongly that if you're on any kind of medication and the doctor says take it every day, follow his instructions, his or her instructions. I wholeheartedly recommend that. After 2 TIAs and countless dizzy spells, I said, well, the only person that can cure me is me. So I started on an exercise program of my own. Every morning when I get off work, I walk right across the bridge. That's a nice 42 minutes. At a brisk pace, that's enough exercise for the day. I learned that you've got to take care of yourself. You've got to cut down on smoking. If you smoke, don't. If you drink, if you have more than 2 drinks a day, cut it in half. I drank a little and I've cut that, less than half. And I monitored my cholesterol, my blood pressure, my pulse rate. Make it a lifestyle, because you're going to have to do it for life. And it doesn't go by age. It goes by the disease you have, high blood pressure, and you've got to work at it.
If you have high blood pressure, control it. High blood pressure or hypertension multiplies your risk by 6. It can be controlled through diet, exercise, stopping smoking, and medication. If you control your high blood pressure, you'll reduce your risk of stroke. If you smoke, stop. Cigarette smoking is a major risk factor for stroke, just as it is for heart disease, cancer, and other diseases. If you smoke, you double your chances of having a stroke. If you drink more than 2 alcoholic beverages a day, reduce your intake. Drinking more than 2 alcoholic drinks a day increases your risk by 3 times. If you don't get much exercise, start exercising as recommended by your doctor. You can exercise effectively by taking a long walk, that is over 20 minutes, 4 times a week. There are lots of things you can do without joining a gym. Talk them over with your doctor.
if you really want to reduce your risk, then you have to change your lifestyle. By changing your lifestyle, you have to start eating correctly. That's giving up red meat, giving up fatty foods, fried foods. And there are many cookbooks out there that will give you all kinds of tips to start cooking healthy.
When you're a fat person, you're in trouble. And a smoker and things like that. You can change it. I know it's hard. After the first time is hard, and after, it's going to be easy and easy.
Before Bob got sick, he weighed 180 pounds. It's a lot of weight for someone your size.
We look at some pictures every once in a while. We start laughing about them. Because I show people that I'm 130 pounds now. They can't believe it. So I show pictures with a big fat stomach. And that was me. And it was so hard walking. Everything was hard. It was so difficult. And my doctor was very upset. My cholesterol was like 200. He says, "You're going to kill yourself." And I started the walking and running and exercise with it. I liked the clothes again. I looked at myself. I said, "Boy, I look really good." And people were saying, "Boy, you're getting younger all the time." I says, "It's not. I'm the same type of person."
Eat properly, low salt, low fat, and low cholesterol. If you're overweight, have diabetes, high blood pressure, or heart disease, eating a proper diet will definitely reduce your risk. If you're overweight, lose weight. We know that excess fat and sugar in your diet, in combination with lack of exercise, contributes to diabetes, high cholesterol, and heart disease. So set an ideal weight target with your doctor and get to that weight.
And I came home, and then I really realized I was really going to have to change. So I did. I don't have any fat in my house. I cook with corn oil. I don't eat eggs because of the cholesterol. I wear different shoes because it makes it easier to walk. I eat brown bread. I'm very careful about my medicine. I put my medicine all together, and it's every morning when I take my medicine, I turn the thing upside down to be sure that I have got the right dosage.
I'm thankful every day that you work so hard and you have a lot of determination, and it's what it takes, doesn't it?
Well, I didn't think it was determination. I just thought of it as something that I wanted to do and had to do, and I was the only one that could do it. And you have to watch your cholesterol. You need to read your labels. You have to watch your high blood pressure. And I even take my own blood pressure. And you have to watch your diabetes. And it's not hard to do. It's something that you can do. It's something that will come naturally if you tell yourself and you convince yourself that, hey, I am going to be better.
If you have high cholesterol, bring it down to normal. High cholesterol increases your stroke risk from 2 to 6 times. You can bring it down by diet, exercise, and medication. If you have diabetes, follow your doctor's instructions to control it. The effects of diabetes increase your stroke risk 4 times. If you eat properly and take your medications and exercise, your diabetes will probably stay under control and you'll reduce your stroke risk. Take your medicine exactly as prescribed by your doctor. Your medications can't help you if they're in a bottle. You must take medicine exactly as prescribed. If you do take your medicine, you can reduce your risk. If you do not, you increase your risk.
I'd like to give you a piece of advice. When your doctor hands you your tape, he'll also give you a booklet. In that booklet is a page on stroke prevention. There's 9 points. Tear it out and tape it to your refrigerator. And then you learn it.
In addition to undertaking the risk reduction activities that you've just learned, your doctors prescribe for you a drug called Ticlid, which is the brand name for ticlopidine. Ticlid belongs to a group of drugs called antiplatelet agents because it acts on specific cells in the blood called platelets, which are involved in the blood clotting process. Ticlid reduces the risk that a dangerous clot, that is a thrombus or an embolus, will form inside your blood vessels. Normally, the platelet's job is to repair damaged blood vessels. Platelets become sticky and clump together, forming a blood clot at the site of the damage. This stops the bleeding, just as it does when you cut yourself. That's normal. But the buildup of atherosclerotic plaque in your arteries causes the platelets to clump together at that site and form the dangerous blood clots that produce strokes. Ticlopidine inhibits platelets from clumping together and forming the thrombus or embolus. That's why your doctor's prescribed it for you, to help reduce the risk of stroke by reducing the likelihood of dangerous blood clots from forming. Because the effect of Ticlid is to reduce clot formation, it can prolong normal bleeding. Therefore, you should notify your doctor or dentist anytime you're planning to have any surgical procedure, even minor surgery or a tooth extraction, or any procedure that may cause bleeding. To be effective, Ticlid must be taken twice every day, for as long as instructed by your doctor. You should take it with a meal or just after eating. Taking Ticlid with breakfast or dinner is a good way to remember to take it, and that's very important. You may have to take Ticlid for the rest of your life because once you've had a stroke or a warning sign, you will always be at increased risk. The idea of taking a drug every day when you don't feel ill may be strange. Most people think of medicine as something we take when we're sick and then stop taking when we're well. Ticlid is a different kind of medicine. Its purpose is not to cure an illness, but to help prevent stroke. For this reason, you may have to take Ticlid even though you feel that you have made a complete recovery and you feel fine. Remember that even though you may feel no symptoms of stroke, ticlopidine is actively working to reduce the chances that a thrombus or embolus will form, causing you to have another stroke. Never stop taking Ticlid for any reason unless you've had an adverse reaction and your doctor tells you to do so. But if you have any of the following conditions and you've not told your doctor about them, tell him or her immediately, and do not take Ticlid if, first, you have a blood disorder or serious bleeding problem, such as a bleeding stomach ulcer. Second, you have severe liver disease or other liver problems. Third, you're pregnant or you're planning to become pregnant. Fourth, you're breastfeeding. And fifth, you've had an allergic reaction to Ticlid. A few patients have experienced some mild or transient side effects which usually go away in 1 or 2 weeks without discontinuing therapy. These include skin rash, diarrhea, stomach or intestinal upset. However, if they should occur and they seem serious or persistent, or if you're concerned about them, you should contact your doctor immediately. Nevertheless, you should not stop taking Ticlid unless instructed to do so by your doctor. More serious side effects can occur, but they occur infrequently. One of these is jaundice. The main signs of jaundice are an unusual yellowing of the skin or the whites of the eyes. Sometimes the bowel movements are also an unusually light or yellow color. If these symptoms are seen, do not stop taking your Ticlid tablets, but contact your physician immediately. There's one particularly serious side effect called neutropenia you need to know about. A few patients who take Ticlid, about 2 or 3 out of 100, have a decrease in the number of their white blood cells called neutropenia. If this problem should occur, it usually does so in the first 3 months, although it can occasionally occur after that time. As you may know, the body needs white blood cells to fight infection, which means neutropenia is a serious side effect. The only way to detect neutropenia is to have your blood tested every 2 weeks for at least the first 3 months of Ticlid use, or as directed by your doctor. Therefore, be sure to keep all of your scheduled appointments for these blood tests. It's also very important that you call your doctor immediately if at any time during the treatment with Ticlid you have signs of infection, such as fever, chills, or sore throat, because that may mean that you have neutropenia, and if left untreated, could lead to a serious infection which may be life-threatening. When you take Ticlid, you must commit yourself to coming into the doctor's office or laboratory faithfully at least every 2 weeks for the first 3 months of therapy to take the blood tests. That's part of your commitment to reducing your risk of stroke. I hope that this video has helped you understand more about stroke and the warning signs for stroke, and I encourage you to take steps to reduce your risk and help prevent a stroke.
I'm Jacqueline Mare Townsend, Miss America, 1963. I was leading a wonderful life. I married John Townsend, and we have 2 children, Bill and Kelly. In 1970, the day after Thanksgiving, I awoke from a very deep sleep, paralyzed and unable to speak. I had had a stroke. Like so many people, I had no idea what a stroke was, how it happened, and why it happened to me. Many people think that they can modify their lifestyle and overcome the risk of stroke overnight, but it doesn't work that way. It may take a long time. You can start out slowly, but you have to start. Set small goals and work on them one day at a time. You may get frustrated, but don't give up. With work and determination and a great deal of love and support from family and friends, you will get better. Living with risk means you reduce your risk so you can live a better life.
I'm Jim Lannon, Executive Director of National Stroke Association. I would like to invite you to join National Stroke Association, an association of people, stroke survivors, physicians, nurses, therapists, and friends. NSA is one of the biggest groups of people with a common interest in the United States. Call us toll-free at 1-800-STROKES. We have a wide variety of resources, a whole network set up to help you be stroke smart and live with risk.
I hope you'll join us.